Hello, we're back with my shaky cam once again, and this is 3 questions about the Pain Diaries. So let's start with question number 1.
All right.
Who are you?
My name is Kelly Shinkaruk, and I'm one of the chronic pain physicians working at the Chronic Pain Center in Calgary. I'm an anesthesiologist by background and did extra training so that I can treat people with chronic pain, as well as sometimes do interventions.
That's interesting. So I have a question. When I first started researching the play in 2008, we used to quote that like 20% of the population had chronic pain. 2010, when we produced the play, we were quoting 25%, and now we're quoting like 30% of the population. So, like, what's happening out there?
That's a good question, and I think that there are a lot of factors. It's multifaceted. So certainly we do live in an aging population. So with the aging population, we do see more degenerative changes like arthritis, back pain, joint pain. But in addition to that, I think that people are living longer with other conditions. So for example, people with cancer are being cured more frequently. And unfortunately, some cancer treatments do lead to chronic pain conditions. And otherwise, I think that maybe more people are just going to see their doctors and are going to access multidisciplinary treatments for pain, and perhaps we're just seeing the tip of the iceberg.
That's interesting. So what about us 50-year-old athletes too? All these, my grandmother never ran marathons when she was in her 50s. Yeah.
50-year-old athletes. Well, you know what? I do see octogenarians, and some of them have been very active all their life. And,
They're amazing, hey?
yeah. And some of them are great, and some of them have chronic pain.
Yeah, interesting. I guess I'll have to be careful at the gym from now on.
No more
Yeah,
lifting 300 pounds. That's going to lead to degeneration of your discs. in the
Okay,
back.
I will stop that
Stop
immediately. Okay. So let's go to movies now. Do you
Okay.
like movies?
I do enjoy a good movie.
That's good.
Yes.
Do you what do you think about movies emotionally though? Do you think they can actually teach lessons and hit people on that emotional level where it's going to make a difference and get a message across?
I think so. I think so.
Are there any movies that like you remember that really hit you for some reason?
I like a vast majority of types of movies, and I find documentaries to be, have a great impact. But certainly movies that are based in reality. So, as a physician, I've seen movies like The Elephant Man, which actually made me really, like as a medical student, be really interested in neurofibromatosis.
Right.
Which actually, as an aside, can cause chronic pain. So, but aside from that, I think that it's an excellent tool for education. Children have long been learning about different processes that they might not experience outside of watching a video or something like that. And in addition, we're finding that medical students, residents, even physicians that have completed their training benefit from things like simulation. And that's, can be a combination of things like watching videos, watching practice patients like actors, playing the role of patients, as all the way to doing real life simulation. And I think that video and having patient experience and exposing medical students to that is, I think that it's one excellent way of approaching education.
Interesting. So arts and sciences are crossing paths more than we know.
I think so.
That's fascinating.
Yeah.
Thank you so much for your time.
You're welcome. Good luck.